Good morning, everyone. My name is Alejandra Rodriguez. I have the honor of serving you as your MC today for the Ovarian Cancer Proclamation ceremony. On behalf of our Laredo Public Health Department and City of Laredo, I want to welcome you and thank you for being here. We are gathered here today to raise awareness, to honor survivors, to remember those we have lost, and to stand together in hope and support for families in our community. Public health reminds us that protecting one life protects us all. By proclaiming ovarian cancer awareness, we reaffirm our collective responsibility to educate, to support, and to advocate for health of women and families in our community. Before we begin our program, I would like to take a moment to recognize some distinguished guests who have joined us today. The Honorable Dr. Victor D. Trevino, the Mayor of City of Laredo, and his wife, Ms. Rosa Marquez de Trevino. Dr. Richard Chamberlain, Director of Laredo Public Health. Representing Henry Cuellar, Andres Valquez. And the representatives of Relay for Life of Webb County. Thank you all for your leadership and for your commitment for raising awareness about ovarian cancer and supporting the health of our community. Let us take a moment to acknowledge the survivors, caregivers, and families present here today. Your courage and resilience inspire us all. To begin our program, it is my pleasure to introduce our first speaker, the Honorable Dr. Victor D. Trevino, Mayor of City of Laredo.
Thank you and good morning, Dr. Victor Trevino, Mayor for the City of Laredo. As we know, Ovarian Cancer Awareness Month is observed in September. This month is dedicated to bringing awareness, raising awareness about ovarian cancer, promoting early detection, and supporting those affected by the disease. We just concluded a breast cancer awareness discussion earlier this morning in addressing cancer that impact women. And the purpose is increasing knowledge about ovarian cancer symptoms, risk factors, and treatment options. Advocate for research and funding to find a cure. Support survivors, families, and caregivers. Encourage regular gynecological screening and early detections. And the activities are as follows. Wear teal, the color associated with ovarian cancer awareness. Attend events and fundraisers, share information and stories with social media, and donate and research and support research and patient organizations. Now, the importance of all of this, ovarian cancer is the deadliest gynecological cancer, and early detection is crucial for improving survival rates. By raising awareness and promoting screenings, Ovarian Cancer Month aims to save lives. And as a medical doctor, I have seen that the best outcomes comes with educating the public and treating early. But just as important is to alert the public that there is support and support of the community. So I always want to thank the people that keep the campaigns going and provide hope and strength for our community. Because together we can succeed in beating ovarian cancer. Thank you very much.
Thank you, Mayor Trevino, for your meaningful and heartfelt remarks. Next, please join me in welcoming Michelle Romani. We are grateful for her presence and the perspective she will share with us.
Thank you, Ms. Rodriguez, for the very kind words. And thank you, Mayor Trevino and Mrs. Trevino, and especially Dr. Chamberlain, who has, and his wonderful health department team, because they've been most supportive. I come as a family of one. We used to be a family of three until January the 7th, 1994, when my mother died of ovarian cancer. In November of 1992, she started experiencing odd symptoms, bloating, frequency of urination, fatigue. She's tried to rule these out by thinking maybe I'm eating too much. At the time, she was working at Head Start as disability coordinator, so she was running around with the kids. So she thought maybe she was tired from that. And then she thought maybe I'm drinking too much water. And so she went to her doctor, the late Dr. Francisco Peña, and they were ruling out everything. And they did the usual gynecological screenings that were commonly done in the 1990s. But in February of 1993, he noticed some abnormalities. And he broke the news to my mother that she had ovarian cancer. At that time, nobody really knew what ovarian cancer was locally. And it was painful as the only child. It was especially difficult to watch my mother go through this. But I will say this, my mother, and I'm not here to canonize her, but she had such a wonderful disposition. She had so much faith that she would be able to overcome this. So she submitted herself to all the treatments that she had to go through in San Antonio. And because we always did everything together as a family, even when I was working in the legislature at the time, my boss, the late Representative Doyle Willis, was very kind in letting me spend as much time with her as possible. So she would go to San Antonio, get her chemo treatments, and then come back. For those of you who have gone through cancer, the chemo takes a toll on your body, as you well know. But imagine making the drive from Laredo to San Antonio, going to get chemo, and then you come back drained, and how she still found the energy to come back to work the next day with the kids. The kids were what was keeping her going. And after her hysterectomy, we thought, okay, everything is gone. Unfortunately, as Dr. Trevino said, and as the literature states, ovarian cancer is the deadliest gynecological cancer. If it's, because of the symptomology mimicking every other symptomology, a lot of times by the time a woman is diagnosed with it, it's a generous estimate to be given 1 to 5 years. In November, we went for mom's exam with the gynecological oncologist. And as a side note, Dr. Trevino has made mention many, many times in these chambers about the about the dearth of health care in Laredo. And I'm here to state that if there's anything we really need in Laredo, yes, we need more pediatricians, we need more skilled care, but we also need a gynecological oncologist. Because in this day and age, there should not be a need for a woman to have to travel to San Antonio and receive cancer treatments there, when we have state-of-the-art cancer facilities in Laredo, but we don't have the medical staff. So I do urge that gynecological oncology be added to what we need. It's not a wish list, it's a need. But anyhow, her gynecological oncologist told my father and me privately to make this her best Christmas, to make this her best holiday season, because it did not look good. Even after the hysterectomy, even after the chemo, she kept acquiring barium in her stomach, which required a second trip to San Antonio just to drain her because she couldn't get the services in Laredo. And I will say this, my mother was a woman of incredible faith. She didn't want to miss Mass. And Father Critchlow at St. Peter's let her go to Mass in her wheelchair in the sacristy, just because she wanted to be there. And yes, there were times when the struggle took a toll on her. And my mother was the type who, even before she got sick, she'd like to sit in the living room and pray the rosary by herself. My last weekend home with her, I heard her arguing with somebody. And I thought, okay, Dad, what did you do? And no, he wasn't there. He was watching TV in their room. And I asked my mom, who are you fighting with? And she said, I'm fighting with God. And I said, Mom, and she said, it's okay. Father Critchlow said that was a prayer too. And the last Sunday that I was with her, the last time I saw her alive was January the 2nd. And I think that was a time when Pollo Tori had just opened next to Taco Palenque. Now I asked her, do you want anything? She wanted chicken. That was all she wanted because she loved chicken. And it's these little things that wind up being the biggest memories. And the last thing I told her when I gave her a hug was, I love you. And January the 6th, the team from Head Start came and they said, we'll work with you. The kids are not progressing. Can you come back? And my mom said, on January the 10th, I have my appointment with Dr. White and we're going to assess how I can come back. She called me and she said, you're going to be there with me in San Antonio? I said, yes, Mom. And the last thing I told her, the last thing we told each other was, Mom, I love you. Michelle, I love you. We'll see you. January the 10th never came because she died on January the 7th, 1994. I missed my mother by 15 minutes. And those 15 minutes, I will never get back. But I'm here because I want a daughter who may have to be watching her mom go through this, not to lose 15 minutes. Cancer is real. Cancer hits home. Cancer doesn't matter what color we're supporting, but the minute it hits home, it becomes your fight just as much as the person who's suffering from it. And it's been my fight now for the last 31 years. It was my father's fight up until he died on December the 14th of 2019. So now I'm the last Romani standing. And yes, I probably drive people nuts when I talk about ovarian cancer on my social media platforms. But I don't want Mary Beatrice Romani to be just a memory. I want her voice to reach out and tell women to please, please know your body. We talk about the importance of being a bilingual, binational, bicultural nation. But there is a language that a lot of us don't know about. It's the language of the human body. If you're feeling bloated, if you've got frequency of urination, if you feel tired, and you don't know what it means, please talk to your doctors. Because time is a precious commodity. My dad used to say, tempus fugit, time flies. And as women, we need to pay attention. We need to learn what our body is telling us. Breast cancer, you can feel it, you can see it. Ovarian cancer, you cannot. And even some of the more traditional gynecological screenings do not tell you. What is recommended is something called a transvaginal sonogram, and a CA-125 especially if you have a family history. And there was something else we found out in 2012. My Aunt Maddie Smith Gomez, whom some of you might know from domestic violence, died from breast cancer. And they told her about a BRCA test. It's a genetic test because there is a link between the two cancers. And it's most appropriate that we do the Ovarian Cancer Awareness Proclamation, because this is kind of what they consider the bridge week because of that link. So if you have breast cancer, please screen yourselves for ovarian. And if you're like me, a walking time bomb, there's more testing that I have to do every year. But as I said, I am most grateful to Dr. Trevino and Mrs. Trevino. You gave us your time from the heart. Dr. Chamberlain, you have put up with me for so many years, because I feel like I'm the lone person here, because I guess I am. But I am very grateful. And if my mother were here, she was a selfless woman. She really gave of herself. She would want the women of Laredo to take care of themselves. Thank you so much, and God bless all of you.
Thank you, Michelle, for your heartfelt message and for being here with us today. Now I'd like to invite Merari Teran, Disease Intervention Manager at Laredo Public Health Department, to share her insights and the role public health plays in ovarian cancer awareness.
Thank you, Honorable Mayor Dr. Trevino and his wife. Also, thank you, Dr. Chamberlain, Public Health Director and Department as well, and the community partners that join us today to recognize the importance of ovarian cancer awareness. Today we come together to recognize the vital role of women's health plays in the prevention and early detection of ovarian cancer. As everybody already mentioned, and I would like to add just a few things more. Ovarian cancer is the 6th leading cause of cancer-related deaths among women in the United States. Unfortunately, its symptoms are often vague and not specific. As Ms. Michelle has already mentioned, it was bloating, it was just feeling fatigue, but most of us sometimes feel fatigue on a daily basis, and that doesn't mean that we have cancer. But that's so vague and that not specific that makes ovarian cancer a little bit more challenging. And also, as of today, there's not an effective screening test proven to reduce mortality. This is why awareness and prevention actions are so critical. And there are 3 key steps that every woman should know. 1, learn about your family history of cancer, ovarian, breast, colorectal, or uterine cancer. If you are at risk, get or consider genetic testing. And 3, talk to your doctor. Go to your doctor and talk about preventive options that they might be offering to you. At our clinics at the City of Laredo Health Department, we're committed to supporting women health at every stage of life by offering comprehensive preventive and primary care services, including women's exams and pap smears for the early detection of cervical and other gynecological cancers, family planning services with education, counseling, and access to contraception, breast and cervical cancer screenings, in partnership with state and local organizations, referrals for specialty care when advanced evaluation and treatment is needed. As part of the local public health department, our mission is to remove barriers to care by making services affordable, accessible, and prevention focused. We collaborate closely with community partners like you all and local hospitals to ensure women receive seamless, comprehensive care. By promoting prevention screenings and delivering patient-centered services, we aim to reduce the burden of cancer and chronic diseases in our community. Ovarian cancer awareness remind us that women's health is not just priority during awareness months. It's a daily commitment. Self-care means asking about your family history of cancer, considering genetic testing, and having honest conversations with your doctors. I invite every community member to take advantage of the services that we provide at Laredo Public Health Department and help spread the word about the importance of early detection and prevention care. Together, we can save lives and strengthen women's health in our community. Thank you.
Thank you, Merari. Your dedication for women's health and your ongoing efforts to educate and support our community. Thank you. At this time, it is my honor to invite Dr. Victor Trevino, our mayor, back to the podium to present the official Ovarian Cancer Awareness Proclamation on behalf of City of Laredo.
Couple of words before we go into the proclamation. Like Ms. Romano was saying, early detection is important, and we have things called tumor markers, but you have to bring it up to your doctor and ask for them. See, the CA-125 is the tumor marker for ovarian cancer, just like there are tumor markers for other cancers like liver cancer, colon cancer, pancreatic cancer. They all have tumor markers. But if you don't bring it up and you don't ask your doctor, they routinely won't do that. So a tumor marker for ovarian cancer, the CA-125, will detect a tumor even if you don't have any symptoms. So if there's a family history or if you have early symptoms that are vague and not necessarily associated with ovarian cancer, bring it up to your doctor and ask for the CA-125. Remember that number. That's a tumor marker for ovarian cancer. All right, well, that will proceed with the proclamation. Office of the Mayor, City of Laredo, Texas, proclamation. Whereas ovarian cancer is the 5th leading cause of cancer deaths among women in the United States and causes more deaths than any other gynecological cancer. Whereas in the United States, a woman's lifetime risk of being diagnosed with ovarian cancer is about 1 in 78. Whereas the 5-year survival rate for ovarian cancer is 50%, and survival rates vary greatly depending on the stage of diagnosis. Whereas there is currently no effective diagnostic tool for screening and early detection. Increased public awareness and symptoms and risk factors of ovarian cancer will enhance chances of early detection and increase survival rates. Now, therefore, I, Dr. Victor Di Trevino, by the virtue of the authority vested in me as Mayor of the City of Laredo, County of Webb, State of Texas, do hereby proclaim September 2025 as Ovarian Cancer Awareness Month in Laredo, Texas. All right.
Do we have it on in front of the podium? 1, 2, 3. We're good? Sure.